The US President planting a tree at the White House to mark Earth Day and using the occasion to declare he would be opening up the national parks soon. But the majority of state governors, and judging by the polls, the majority of American people, want the stay-at-home orders to remain in place until his own federal guidelines are met in the fight against the coronavirus.
I get the pressure, but we can't make a bad decision. Frankly, this is no time to act stupidly, period. I don't know how else to say it. And I've said it innumerable times to local officials on the phone. I get the pressure, I get the politics, we can't make a bad decision, and we can't be stupid about it.
The lack of testing and fears about how far the virus has really spread are fueling these concerns. On Wednesday, a California county announced that new autopsy results show COVID-19 was spreading in the US in mid-January, weeks before the first previously known US death. And it was spreading among people with no travel connection to Wuhan.
We know that each of these deaths, especially since there are 3 of them in February and early March, they're really like iceberg tips. So they're indicators when you have an outcome like death or ICU, that means that there's some iceberg of cases of unknown size that underlie those iceberg tips.
That means the US is likely to have had many more unrecorded cases and deaths than previously thought, and that health officials were unaware of the early spread of the virus. And disappointing news for a drug that the US president touted enthusiastically and often from here at the White House. Hydroxychloroquine in US trials was found to have negative effects on patients. And one senior US health official says he's been removed from his post because he refused to push the president's favorite drug. Nathan King, CGTN at the White House.